Heaven is shaken, and today it gained one of its most beautiful angels.
Let's talk about cerebral aneurysm. If you're not familiar with me, I'm Dr. Billakotamd. I'm a board-certified neurologist and epileptologist. Cerebral aneurysms are basically outpouching of the blood vessels that feed the brain. Usually it's because there's a thin spot in the blood vessel or because your blood pressure is so high that it's creating a lot of dynamic force on the actual blood vessel, leading to this outpouching. When aneurysms rupture, you can have what we call subarachnoid hemorrhage, where the aneurysm bleeds into the subarachnoid space. It looks like this. Recovery can be difficult. Not everyone who has this does well. In fact, the majority of the folks who don't. So let's talk about cerebral aneurysms, what they are, what causes them, the epidemiology, screening, and treatment. As previously mentioned, cerebral aneurysms occur when there's an outpouching in the blood vessel, usually because the blood vessel wall is thin or the blood pressure in the blood vessel is so high that it outpouches and pushes up against the blood vessel, causing either saccular aneurysms or fusiform aneurysms. About 3.2% of the whole population has cerebral aneurysms. They're not always something that is symptomatic, however. So a lot of the times people who have aneurysms walk around and they don't know they have them. They occur at a 1-to-1 ratio between men and women. So I mentioned about 3.2% of the general population has aneurysms. That translates to roughly 6 million people, but only about 30,000 of these rupture on an annual. So although the rate of rupture is low, those who do have a rupture of the aneurysms for the most part do poorly. About 80% do not do well. So what makes you more predisposed to this? If you have family members that have intracranial aneurysms, your risk increases. Your risk also increases if you have genetic syndromes with higher risk of cerebral annual formation. These usually include genetic syndromes that affect connective tissue, including polycystic kidney disease, Ehlers-Danlos, and a few others. In fact, here's some data on if you have first degree relatives with aneurysms. If you have one first degree relative with an aneurysm, your chance of it goes up to 0.8%. If you have two first degree relatives, that's 7.1%. If you have a second degree relative, that's 0.3%. And this is a 10-year risk of subarachnoid hemorrhage secondary to ruptured aneurysm. The best test to detect this is with a CT angiogram. CT angiograms aren't always accurate. There are some false positives that come around, especially the smaller your aneurysm. Due to this, we do not screen asymptomatic people of the general population. We only screen if you are higher risk, such as if you have family members that increase your risk. Usually the screening is done once every 3 years and then every 5 years moving forward. Screening with genetic syndromes is still kind of up in the air. Some doctors will do it, some won't, but there's no standard guideline. Treatment is found is with either stenting, coiling, or clipping, or open repair.